Welcome to the Roots podcast presented by Elite Anesthesia, where we dive deep with dental professionals about the challenges, breakthroughs, and stories behind their successful practices. Today we have Dr. Jared Hepworth with us from White Ridge Aesthetic Dentistry. Welcome, Jared.
Excited to be here. Absolutely.
Jared owns White Ridge Dental, which is just right down the street from us. A man and a practice that we've been involved with for honestly since the inception of Elite 5 years ago.
Yep.
You've been around since the beginning. Pretty exciting.
It is. It's been fun, well, to not only work with you guys, but to see you guys grow.
Yeah.
And see that development. It's been awesome.
We've both been through a lot, I would say, over these last 5 years.
Yeah, it's crazy to think of where we started and where we are now. All good things.
All good things. Yeah, it's I think seeing you guys is always so fun because for two reasons. Number one, I immediately think about where we were at the beginning of all this. And number two, it's fun to reflect on the whole journey of where we're both at right now.
It's like seeing family.
It's like seeing family. That's exactly what it is. With, a fair amount of time in between, which is like seeing family is kind of good too.
That's true. Yeah. Not too much.
Yeah, not too much. So tell me, obviously you own White Ridge right now. Mm-hmm. Tell me about dentistry. Tell me about getting into dental. Kind of where the initial interest was, where you went to dental school, if your wife was on board with that kind of thing.
Yeah, working with a bunch of women.
Yeah,
that's always a hot topic. I had already committed to a dental school by the time we were married, so she didn't have much decision there.
Choice.
I don't think too many people argue with having
right way to
dentist as a husband. So, but the initial interest started back in high school. It was, I always was drawn towards just the medical field in general, wanting better understanding, just the human body and how things work and, why things break down, the opportunity to help people figure things out, illness or otherwise. And so I was always drawn towards that field in general. I had no idea what I specifically wanted to go to, but that was an interest in going into kind of science in that field. But then when, you're an awkward high schooler and then you get braces on and, that was the first time getting them off was the first time I really looked at the smile, it's like, oh, that's cool.
The results.
Yeah. What they did, you know? And so then I started noticing other people's smiles. I started looking at teeth in a different light. And so that was when I started to think about looking to the dental field and realize art was always something I was into as well. And so to think, okay, this is a profession where you help, it is in the healthcare field, but then also I get to use my hands to do things as well. So the combination of those things piqued my interest with dentistry. Yeah. And so then it was one of those, situations where in high school I was like, you know what? I think I want to be a dentist.
Made the decision.
Mm-hmm.
Made it early.
And then just picked some major that would get me there and followed that path. And so, kept going that way. Went to Roseman University of Health Sciences here in Utah.
Here in Salt Lake.
Yeah. First dental school here. And part of the guinea pig class, the inaugural class.
The initial one with Roseman.
Yep.
How was that?
It was good. It's had a good experience there. It's like anytime I think someone's a part of the first class, they're trying to figure things out too. So there's some interesting things. But we had a really cool, unique class. There was a second career for a number of people. So we had like an older class that had some life experience. One of my classmates had 7 kids, and this was a second career for him. Phenomenal guy. And then amongst others who were CEO of maybe a company and now wanting to go a completely different direction. So that was fun because there was some a business mindset amongst some colleagues and things, and it created really cool camaraderie of that just relationship, and it's been fun to see what other colleagues have done. Yeah,
that's something I wanted to ask you. You go to school to become a dentist. You're the owner of a practice now. When you're in dental school, is that something that they talk to you about, or does it feel like they trick you into dentistry and then at the end of it, they're like, by the way, like you have to own a business too.
Oh, and here's $500,000 of debt.
Yeah. If you're lucky.
Yeah. I don't know if trick is the right word, right? Not that it's by intention, but gosh, do they prepare you for business? No, not at all.
Yeah.
Like, and I'm sure every school is a little bit different, but I think we had a 2-week class, as if that's sufficient to cover some
2 weeks
MBA
out of 4
course.
years.
Yeah, exactly.
Seems like enough.
So for sure, I think they feel like their responsibility is we're going to teach you to be a good dentist and doctor.
Yeah.
And then you figure it out.
What you do with it is up to you afterwards.
But that makes it so difficult because they're not setting you up, in my opinion, the right way. But that's to get into a whole nother topic of academia and what, from my own personal opinion.
Well, I just think it's interesting. I mean, you and I are both business owners at this point, both of us medically dental trained, with very little, that was my experience as well. Not that I had intentions of being in this kind of phase, but owning a business is difficult, and it just feels like it would have been nice to have somebody present that early on in training to give a little bit more, I don't know, real life experience, or at least plant the seed of like, these are the things that you should be thinking about as you move through your education, because this is really what being a dentist is. We're teaching you a skill, but your life is really going to revolve around building a business, managing people. That's a totally different skill set that we weren't trained to do at all.
I completely agree.
Yeah.
And it's something that, because you can know how to diagnose and maybe treat something, but you're absolutely right. If you don't know how to communicate with a team, lead a team, if you don't know what a P&L is, right? Like just some basic principles. But if you don't know how to run this stuff, then it's not going to work.
Yeah. And I think, you made a point about your debt. You and I both got into debt to be able to do or acquire the skill that we got. Obviously, maximizing the potential of our degree or the skill set that we obtained is important. I think, and that's not exclusive to us. I think anyone that graduates with any type of advanced, I guess, degree in general, specifically medical or dental at this, for this podcast, you want to make the most amount of money that you can, within a certain type of practice or lifestyle. And I just think it's an overlooked piece. Like, it's important. You need to pay that debt off. You need to move forward and provide a certain type of lifestyle for your family that everyone has expectations for, that they're sacrificing to get to at the end of it. Yeah, I don't know how I don't know how we make that change, but it seems like it would be nice if something did.
I agree completely.
Yeah. I want to ask you a quick question about your the dental school training. Mm-hmm. Was there ever a mention of anesthesia in that training at all?
Oh, that's a great question. Now you're really testing my memory. That's over 10 years back. But to be perfectly honest, I don't think so.
Really?
Like, I don't, even as it related to oral sedation, like there was, that I can remember, there wasn't an introduction. I mean, maybe some small thing in passing, but clearly no
course. Nobody came in and said, this is a big part of practice that you should think about.
No.
That's interesting. I've thought about that and wondered, now that we interact with so many dentists.
Yeah.
I have my suspicions, but and not that you could speak for every program, but it seems universal that anesthesia is somewhat of an afterthought in your practice.
I think you're right. And I think especially, now this isn't always the case, but I think about a lot of the faculty in dental school and thinking about their experience, because I had opportunity to talk with a lot of them, and the type of cases that we do that many times are so beneficial with anesthesia. Mm-hmm. I don't think a lot of them are doing those kind of cases. And so I don't know how it's at the forefront at a lot of what they did.
Interesting. Very practice specific.
Right. Yeah. Not to say, of course, it doesn't have a place in even day-to-day dentistry, though, for sure.
Yeah. Yeah. And I want to get into that because I think that's definitely been one of the most interesting parts of this whole deal for me personally. Like, when we first started doing, I guess, surgery, anesthesia together 5 years ago, it was obviously all surgery focused. We did a lot of all-in-fours together, amongst some other cases, but all surgical. And what I've really learned over the last 5 years is I think the demand for anesthesia from our patients is quite a bit higher than we are, I guess, willing to see. And I think that that's kind of changing. And I've seen that change in my time over the last 5 years.
I mean, I see it in our practice for sure. And it's kind of a combination, because to your point, I mean, even dating back to dental school, the fact that that's not taught at an early time. First, the education just on anesthesia needs to be understood and accepted on the doctor's part, because then once you understand and see that and see it in practice, then it makes it easy to present that option to our patients, right, on a more regular basis and create that option. And then so, of course, it's readily accepted once we understand and see that. So I believe it is becoming more readily understood that option's available. Yeah. Part of that, though, is the doctor better understanding and how that plays into their practice.
Yeah, I'll ask. We'll go in and do like a dental anxiety specific case, maybe even for a cleaning, and I'll ask, like, how do you make the decision? Is it the patient that comes to you? Are they shaking and sweating in their chair, and so you what's the trigger for you to say, I think we should offer anesthesia to this patient?
That's a good question. For the most part, they'll come out and tell you. They'll say, really? I hate the dentist. Yeah. Thank you. That is me, right? And I hear that almost every day.
It's your burden to bear.
And that's right. You just can't take it personally. Otherwise, it becomes hard. But,
of course not.
But they mention that. And so one of my things, though, I love it when they say that. Yeah. Because sometimes they are fidgety or nervous, but they'll usually tell me when they say, I hate needles or I hate the dentist or whatever it may be. And then I always follow that up. I don't just brush it off. Well, tell me what it is about the experience that you don't like specifically. Because for some people, they're like, everything, right? Yeah. And but for others, it's like, it's just the shot, or it's the sound of the drill, or whatever it may be. It's specific to that person. Then I do gauge. It's like, this might be something that's just some nitrous is going to calm them down. They're going to be fine. Yeah. Maybe this is an oral sedation. Maybe they need to be put out completely, because some of those patients who are terrified to get anything done have that experience with you guys. And then they come back and go, that was the best dental experience of my life.
Yeah. Well, thank you. No, I just think it's interesting. We've developed this vision at Elite. You have your mission and vision statements. We've developed this vision at Elite that is, every patient has the opportunity to be put to sleep for any procedure or any case. The philosophy behind that is that we feel like patients should have the choice. Obviously, I think that's an evolution, being able to do that. Obviously, if you are going to offer that to your patients, you have to have some confidence that you have somebody to deliver on that. Whether it be you doing oral sedation or having somebody else come in. I think it would be interesting to see if you offered anesthesia to all patients that walk through. Not that you're trying to tell anybody that they should or shouldn't. I guess the question is, how many patients walk out that would have done a case, that didn't do a case that would have done it if they had some type of option for their dental anxiety that maybe they didn't express. We have this doctor that works for us. When we hired her, I had her here in the office, and I just said, why did you take this job? Why is this interesting to you? And she said, I have severe dental anxiety. Had some things, cases done as a kid, and it just caused a lot of trauma for me. And she's a young, very put together physician. Somebody who, walks into your office and you wouldn't immediately think we're going to have to offer something to this person. And she is told, when I asked her, does she get anesthesia with her dentist? She told me that for years, 10 or 15 years, she put off any type of dental work because didn't feel like anesthesia was an actual option for her. And, that was why this job was interesting to her, to be able to provide an option for patients like her that, wouldn't even get a cleaning done without being actually totally put to sleep. It's kind of interesting.
And it can restore their faith in the field through anesthesia, right? Yeah. And it is, I think you're right. I think there's a lot of cases, those day-to-day, the people that come in every 6 months, that's a different story. But when new patients especially, that's something I like to kind of bring up and ask about, especially if there's any bigger treatment. We'll focus on the treatment, but we always finish with, okay, let's talk about sedation. Yeah. So we do, to your point, offer that to every single person, because they'll let us know, oh, no, I'm totally fine. Yeah. Or, yeah, that sounds great.
Yeah. And I think that's exactly the point is we talk to a lot of dentists who, I shouldn't say gatekeep, but kind of, it's like, unless this patient's visibly sweating in the chair, like it's just not really interested in it. And I think ultimately, as a dentist trying to do the best for your patients, also as a business owner trying to do the best for your patients, offering a service to your patients that they want is important.
Yep.
So in dental school, we'll just move to graduation, unless there's anything you want to get into at dental school.
No, that's good.
Did you mentioned that you got married in dental school or before?
Right when it started.
Right when it started. Yeah. And then did you guys have kids while you're in dental school?
Yeah, we had one little girl, my oldest. We have 4 now, and which that's what my life revolves around is my kids, and that's what life's all about, spending time with them, creating experiences, memories with them. So that's what I love doing.
It's awesome. We've always been able to, I think, connect on the family aspect of this, which is at the end of the day the most important part.
Mm-hmm.
So you have 4 kids. You only had 1 in dental school.
Yep.
Married, graduated, and then where did you go from there?
So I went out. I worked 6 days a week. Speaking of, just wanted to get as much experience as possible. So I worked in private practice and in a DSO.
Okay.
For some time. And
did you do that here in Salt Lake?
Yeah.
Yeah.
Yep.
Okay.
And then went exclusively to the DSO for a time, and then had the opportunity to buy my own practice. And then that's where I'm now and where I've been for the last few years. And so, which was really good to see some private practice, some DSO, which honestly did give me some of that exposure into the business side a little bit, because I was able to pick, the CFO's brain and CEO and talk some about some of those things and how things were set up. And then of course, starting my own.
What do you feel like working with the DSO as you look at your practice now? How many years have you owned your practice?
Let's see, you're coming up on 8.
8 years?
Yeah.
Wow. What do you feel like you took away specifically from working at the DSO?
Pros and cons, because I think from, that dental support organization, they have a lot of good things set up, especially from a business mindset, because those are the things they're looking at. They're looking at numbers and looking at metrics like that to make sure things are running well. But then, of course, I'm the one in the office, working with the team and working with the patients. And so that way you get kind of that dichotomy between, you need to focus on numbers, because if you don't have a business. Mm-hmm. But at the same time, this is very much a people-oriented business. And so that relationship is super important. So taking the best of both, right? Because there's things, any organization is going to have pros and cons with it. And so there's some things that I really liked from it, and there's some things I didn't like. So to be able to take that and then piece together what I felt like was a good combination of my own practice was valuable.
I think that's really interesting. In my own, business and career, I've been able to interact with better business minds than mine. And I think, through osmosis, it's been helpful to me, helpful to our company. Yeah, I think overall just appreciative of like getting to interact with those type of people that, they put that first, that the business is, that is their training. Mm-hmm. And I think being able to understand a little bit more from their mindset. So got into your own practice, you worked with a DSO, got into private practice, bought your own. We know your partner really well, Rick as well. Tell me about choosing a partner. That's a pretty big decision.
It is. And that was, gosh, I wish I could say that I had, an algorithm that perfectly picked him out, because I think anybody would love to work with Rick, because he's an incredible guy in every way. But ironically, he was the first guy that I reached out to. So it was essentially a connection made when I was just looking, for doctors who were interested in work in the area. And I connected with him. He was the first doctor I interviewed.
Really?
And immediately you could tell.
He was fresh out of school, wasn't he?
He was.
Yeah.
So
he was just looking for a job, and you guys got connected through a friend or something?
Yeah, it was like a dental recruiter.
Okay.
And who was a friend of his that made the connection. And so it worked out for just a couple days, because at that time I was focusing more on surgery. And so it made sense. He came in for some more general dentistry. And then as we were expanding, things were going great. He was one of those that came out of school and it felt like he had already worked for a while.
Yeah.
I think it was a neat experience for him, because within a year he had gone from, school, you're doing fillings and crowns. And then by the end of the year, he's doing bone grafts, implants, even full mouth reconstruction, which I think was a really neat opportunity for him.
Yeah.
And within a couple years, I mean, he seemed like he had, lots of time under his belt.
He came out well prepared.
Exactly.
Well, he came from one of the better institutions out there, which happened to be where I went to school as well.
Oh, is that right? There you go. But he was well prepared. And he also is somebody that I think that picks up on just procedures so well. And so it kind of made it easy at that point. We would work together for a couple of years. The practice had grown a lot with him being there. Everybody loved working with him, and it was a really easy decision to make that partnership available to him. And things have been going great ever since then.
Yeah, Rick's a great guy. I mean, you guys are an awesome tandem. Tell me about your practice just briefly. Like, what do you guys focus on? What's the overall, I guess, philosophy of what you guys are trying to accomplish as dentists in your own private practice at White Ridge?
What our practice looks like, I mean, ultimately our goal is what we're striving to create is the ideal, like, oral health opportunity that leads to the best systemic health for our patients, to improve their quality of life, to live the best life they can live. And that can look, many different ways to different patients. But, the more we learn and the more we do, we just see how, the oral health is so important as it relates to our systemic health. I just had a patient who's a neurologist who was just giving us this article about the connection, between our periodontal health and the direct correlation to the risk of dementia.
Yeah.
And so to see those kind of studies, and of course the ones we know related to the heart and whatnot, it's just directly related in more ways than we realize, even airway with sleep. And so our goal is to create the most ideal way to educate our patients so they're aware of where they currently are and what would be the best things to do to get them to the most ideal position so they're living the most healthy and best life that they can. And then a lot of times we get patients coming in for consultations who aren't in a good place, and they need to start over completely, whether that is a fixed arch option or a combination of implants and some crowns and restoring things. But we try to look at everything as a whole to put them in the best place that we can. And so it's kind of unique where we've been able to set it up. It's a fun dynamic where Rick and I are able to alternate, right, where we kind of have more of a general dentistry hygiene day where we can focus on some of that day-to-day and that educational side. And then we alternate where we have more of a surgery or cosmetic day where we can do consultations and we can do some of these bigger cases. Those are the days when you guys come in so that we can spend 6 hours, or whatever it may be in the operatory without having to step out for a hygiene exam. And that's worked really well for us where we're alternating days, and it's a good mix of kind of both of those fields.
Yeah. I think it's really interesting, the effects of dentistry, or I guess oral health, on our overall systemic health. One thing that I've come to understand, dental's kind of I shouldn't say it's a new field for me now, but it was 5 years ago. One thing that I've come to appreciate through your practice and others is the effect of our oral health and appearance on our overall well-being as a whole, not just systemic health, but I think the way that people feel about themselves and how that translates into their, everyday life. Do you feel like, I feel like that's something that you guys do exceptionally well. You guys treat the patient as a whole. And I think being able to deliver on both aspects of that, I've just seen in your practice how that plays out in real life. And it's probably the coolest part of this for me. Obviously, taking good care of patients on our behalf is good. Making sure that patients are safe and healthy and have good anesthesia, that's all important. But overall, facilitating a good outcome for a patient is really cool and really impactful. And you guys just do that so well.
That really is probably the most rewarding part of what we do, because you're right. When we say systemic health, we tend to think of our physical health, but you nailed it. Our mental, emotional, that social health, like that overall well-being, that's such a critical part of our overall health and the longevity, right? That interaction and the relationships that we have in our life. And so speaking of that, like there's one, I'm just thinking of it because we were just putting kind of some new pictures up of some before and afters. And there's this one patient that we just finished up with. And to that point, he came in. And one of the things I feel like we take the time to do is to understand where the patient's coming from and not to look at them as, okay, here's a pano. Where's the infection? What do we need to do to treat it? Awesome. Get on your way. It's, yeah, that's a part of treating the individual, but what's their story? Where are they coming from? And where do they want to be? Yeah. And so this gentleman, for example, talked about how his family had mentioned that something changed and he's not really the person he used to be. And for him, he felt that he was so embarrassed because his teeth he had lost some teeth and they had ground down over time. And, and so he found himself being reserved in social settings. And so his personality changed because of that. And so it's emotional experience for him to share that with us. Yeah. But then that gives me the motivation to say, okay, this is the outcome we're looking for you. And I would love to be able to get this back in your life. Now you have to always be careful to promise certain things, but we want to be a part of this transformation. And I can't tell you how many times he's teared up even since then throughout this process and giving us the biggest hugs and talking about how you gave me my life back. Yeah. And how his family has commented on it. And even from that consultation, his just outgoing, gregarious self, that it's like this has always been him, but has been hid away for years. And for him to get that back in what he feels like is, a prime time of his life with older kids and grandkids, it's life-changing. And so to your point initially of talking about just that emotional and mental health and well-being, it's critical. And it's awesome to see that kind of transformation.
Yeah. It's been an amazing thing to be a part of. Like, I view our role in this as a facilitator and get to kind of be in the sidecar of what it feels like to be able to transform somebody's life like that. And it's really turned into kind of a driving part of what we do. Just envisioning the number of people that are out there that wish that they could get to that good place in their life, but can't for one reason or another. And if dental anxiety is the reason, us being able to be here and facilitate, maybe unlock that door for them to walk in and for you to actually do the work, that means everything to me and us as a company. I think it's a short life we live, and to be able to facilitate that type of thing for somebody, especially in the way that you guys do it. Like this isn't a smile factory. This is actually, getting in and understanding a human being and doing whatever it is that needs to be done to make them better.
That's absolutely right. No, I couldn't agree more. And I love that you said that. It's not just a smile factory. Like we are in the business of changing people's lives for the better. And it's a special opportunity.
Yeah. And your patients can tell. People can tell. I think all of us have that in us. And it's something that I've always appreciated about you and Rick. Tell me, I guess to wrap up, tell me about White Ridge. You guys, what are the plans over the next few years for White Ridge?
Good question. I think Rick might get tired of it, but I'm always thinking of new stuff to do or to change. But part of what, we were talking at the very beginning with sedation and just be knowledgeable about that. It's the same thing with, there's so many aspects of dentistry that appeal to me, and it's almost frustrating to realize we don't have enough time for everything and trying to fine tune. But the part that's getting me excited right now, beyond what we're doing, is the airway I kind of mentioned before, and of course the critical role that sleep is in our lives. That I think that a lot of people don't realize. Yeah, everyone knows it's important, but how important that really is, and how much it affects us, and how many people are affected by that. So one of the things we're looking at is the exciting part of expansion by just moving teeth around and expanding things to help open up airways to put people in a better place. So that's kind of a new way we're going. beyond what we're doing as well, because you start to see, once you learn about it, you start to see the need for it more. So aside from all the bigger cases we're doing, there's a lot of people in between that don't have to start over on things, but at the same time, their occlusion could be in a much better place. And so it's kind of a new route for us that we're looking into as well.
Some small changes that they can make to make pretty big improvement overall, I think, impact on their life. That's awesome. I didn't know that you guys were doing that.
Yeah.
Jared, appreciate you coming in. It's been a pleasure to talk to you. It's always a pleasure to work with you guys. We wish nothing but continued success with White Ridge for you and Rick, and hope to keep working together for a long time.
Well, thank you so much. We hope the same.
Yeah. Thanks, guys. Thanks for joining us again. Jared Hepworth. We look forward to bringing more incredible dentists on and talking more about themselves, their practices, and Elite Anesthesia.